welcome to Plastic Surgery T&A. I'm Earl Stephenson Jr., your Atlanta board certified plastic surgeon. And this is Plastic Surgery T&A. This is a podcast that I put on every Saturday, available on YouTube after 11 a.m. typically. And I realized this Saturday, and maybe even this week, a couple of things. Obviously, I've been doing this for about a year, and I've touched on a bunch of topics over that year. And as we kind of move to the next year, I was thinking what I'm going to talk about today and moving forward. And I really wanted to make sure that I don't repeat myself and not talking about the same things. Because again, that gets boring. No one's going to listen and no one's going to really, you know, pay attention to the podcast, and it may end up floundering. And I don't want that, nor do you really want that, because I want to make sure that you have all the relevant information that you need to make the best decision if you are considering plastic surgery. Uh, so I wanted to talk about a couple of things today. We're having a bit of a smorgasbord. We're going to talk about a couple of things. We're going to talk about number one, we're going to talk about the United States of plastic surgery. That's one topic. And I kind of titled the podcast this, but we're again touch on many things. Probably 2 or 3 days from now, we'll make a tremendous decision about the direction of our country with much gravity to that decision. I realize as I surf social media that on a much smaller and a more intimate scale, clients, patients make this decision about who their plastic surgeon's going to be, who's the best at tummy tuck, who does the best belly button, who does the best eyelid surgery. And a lot of you are listening to me right now going, oh my gosh, it's not even the same. No, it's not the same as far as the ramifications. But you want to choose as the client, as the citizen of this ecosystem, the best candidate and the best candidate for your plastic surgery. Because in both situations, you're going to put your life in someone else's hands, and specifically the plastic surgeon. Because I'm the expert. I'm not a political expert, but I think there's some parallels to be drawn. As a client, potential patient, you're going to decide who is going to provide your mommy makeover, your breast lift, your eyelid surgery, your face lift, your liposuction. You get my drift. And you're literally putting your well being in their hands, your life, your health. For heck, your health of your family, if you're married and you have children, or you have a plus one. This is going to have a significant effect, and you need to choose wisely. So, how do you make that choice? Just like you're choosing your representatives, how are you going to make that choice? There has to be standards, and there has to be standards of training and education, and there has to be standards of character. These are my opinions only. So, if you're going to choose a plastic surgeon, let's just talk about plastic surgery. We're going to get into things about, was this person a facial plastic surgeon or cosmetic surgeon or oculoplastic surgeon or oral surgeon? We'll get into that just a bit later. But if you're going to choose a plastic surgeon, you need to make sure that one, obviously, that this person graduated from medical school. In years past, I would say that there was a bias for doctors that went to American medical schools, went to the University of Ohio State, University of California at Los Angeles, South Alabama, versus someone who went to a foreign medical school, maybe in the Caribbean, But times have changed, people have evolved, technologies and education and resources have evolved. And it was a time, like I said, where the American medical student was viewed here and the non American medical student was viewed there. Those times have changed. There's equality in the candidates for these schools. They're of equal caliber, in my opinion, but they're certainly of equal capability once they graduated. Once they've been educated and trained, they're of equal caliber, whether you train domestically or you train foreignly, maybe in, again, a Caribbean medical school. So that's one. You need to make sure that they graduated from an accredited medical school. And I think that goes without saying. Specifically, the next step to take to become a plastic surgeon is to train in a surgical discipline that is typically here in the United States because different countries have different qualifications on training and certification. And we'll stick strictly to the states. uh, you'll have to train in a core surgical discipline to be a candidate, to have the expertise or prerequisites, better said, to move to become a candidate for plastic surgery training. So, after medical school, core surgical training. And what is that core surgical training? Typically, it is general surgery. So, what is general surgery? People say, well, I was a general surgeon. That's I'm double board certified in general surgery and plastic surgery. To the average person, they don't know what that means. So, general surgery, I think, is important. I think whether you complete a formal residency, meaning 5 to 6 years of specific training in general surgery, so that you can go out, if you so desire, at the completion or at your graduation from that training program and perform the discipline of general surgery, which is really taking care of, in a community setting, surgical intervention or surgical treatments for the gastrointestinal tract or the GI tract. So, if you have a bad gallbladder, or someone out there in the community, you'll see a general surgeon. If you have hemorrhoids that need to be surgically treated, you'll see a general surgeon. If you have Crohn's disease that requires a surgical removal of part of your intestine, you'll see a general surgeon. If, heaven forbid, you have a colon cancer and you need that portion of that colon removed, then you'll see a general surgeon. If you have breast cancer or a mass or lump, not a breast lass, a breast mass or lump, then you'll see a general surgeon. So, those are some of the things that general surgeons take care of in the community. The training of general surgery includes all those things, but they include, really, in my opinion, of how to learn to take care of critically ill patients. Because if you can take care of a critically ill patient and you're out in the community, as let's even say, just as a general surgeon, and you get someone who's got a bad gallbladder and it's really tough to get out and they're really sick, or they become really sick even after was removed, or there was some type of injury to some of the other surrounding organs, and you need to take care of a sick patient, you know how to do that. So, general surgery training is critical for that. That's where we, as trainees at that point in time, learn to take care and become very confident and competent in taking care of the sickest of sick people in this surgical ICU, even participating in the medical ICU, taking care of trauma patients. Uh, that's where we kind of cut our teeth. So, having that core training in plastic surgery sets you up to be in position to obtain plastic surgery training. You can also have other core disciplines substitute for general surgery because no matter if you decide that I want to be an ear, nose, and throat doctor as my core surgery training, which takes about 5 years, or you want to be an orthopedic surgeon, which takes about 5 years, or you want to be a urologist, which takes about 5 years, or a neurosurgeon, which takes about 7 years, or even a dual degreed, that means a dental degree and medical degree, oral surgeon, that takes about 6 years. Before you even get into that core discipline as an intern, just right out of medical school, you have to at least do 1 year of general surgery. That's where you learn to take care of sick patients. You're not so much learning the nuances of taking out gallbladders and taking out colons and doing all these other procedures, but you're learning just how to care for people, how to take sick people that come in the hospital and make them well enough to be prepared for a procedure, or taking people who have come into the hospital uh, and had procedures and getting them well enough to exit or be discharged from the hospital. So that's crucial, 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 crucial. So having core discipline surgery and training is really imperative. You've got to train in general surgery or ENT or oral surgery as a dual degree surgeon, urology, neurosurgeon, or orthopedic surgery. You can then put yourself in position to the for the next step, which is to obtain plastic and reconstructive surgery training. And yes, I use the whole word because people are shortening it up. And I think intentionally and sometimes not intentionally, as plastic surgeons, we shortened up that word because reconstruction has been the reconstructive part has been used against us. That somehow that's almost like a scarlet set of letters that, oh, he just only takes care of things that are broken. But it's that core training in plastic surgery of learning how to rebuild, remake parts that are injured or ravaged by disease, that we as plastic surgeons, once we obtain that training, cut our teeth. So let me give you an example before I say that. Plastic surgery training, once it's obtained and once you've done your general surgery or your other core surgical training after 5 to 7 years, is an additional 2 to 3 years. And so the reconstructive part of that is really important. In my training, I'll talk about my training. I trained at the University of Tennessee at Chattanooga. Excellent, excellent, excellent program. It's a sleeper program. It's not the big surgery programs you hear. I didn't train at Harvard. I didn't train at Mass General. I didn't train, you know, wherever. Take your pick. The brand names. But I got phenomenal training because I got real firsthand training. So the reconstructive part of my training included running our own burn unit. You're like, oh, well, what's that got to do with cosmetic surgery? It has everything to do with cosmetic surgery. When we treat burns, they're first degree, like a sunburn, second degree, kind of like a bad sunburn, depending on the depth of it, you blister. And then there's third degree, which is like no other thing you can experience. But we manage the skin. You're like, oh, that's still not the same. I'm not getting it. When we do a chemical peel or laser resurfacing, that's a second degree burn. So, having the experience of taking care of the worst of the worst, a second degree burn over the torso, somebody spilled coffee on them, on their hand, taking care of third degree burns, unfortunately, from people who have been involved in explosions, taking care of burns that are second degree, and then there was a flash burn to the face, which is kind of a first degree burn, or again a second degree burn. That we have to manage that patient to help the skin regenerate, so that that skin can be the organ it's meant to be to protect whatever on the inside. So applying your chemical peel, applying your laser, resurfacing, and managing that regrowth of skin comes not from just doing a lot of chemical peels. It can, or a lot of laser surgeries. It comes from the principles of knowing how to manage burn patients. That's why it's important. Well, okay. Well, I can understand that. In reconstructive surgery, as part of plastic surgery training, general surgeons sometimes get into an abdomen that's been injured. Let's say somebody was involved in a car accident, they ruptured their spleen, they lacerated, you know, uh, they injured their small intestine, and that's been repaired. But there's so much swelling of all those organs, they can't really close them up permanently. So they close temporarily. They come back in 2 days. They kind of look around and clean things out, and they realize they can't get that closed. If closing that were to occur, it would put undue pressure on those swollen organs and possibly cause them to die. So a lot of times they ask us as trainees for sure, because we need that experience to help close the abdomen. And what we do is we separate the muscles of the abdomen and bring them toward the center so that we can create more space to enclose the swollen organs at the appropriate time. That's rebuilding the abdominal tummy wall. So, hence, you move forward. You're doing a tummy tuck where you lift the skin up, you take off the extra skin, you tighten the muscles of the wall. Nothing nearly like doing an abdominal wall reconstruction, but you understand the anatomy, you understand the mechanics of the muscle, the covering fascia, the skin, and you know how to rebuild that. So doing a tummy tuck, not to diminish it, we can do that. We understand that. If something goes wrong, we understand how to fix it, which is the most important thing. So you get my point. So we have reconstructive surgery. So I trained in burn surgery. I trained in hand surgery. I trained in craniofacial surgery. Trained in craniofacial trauma. We did breast reconstruction. We did lower extremity reconstruction. We did malignant tumors of the skin and head and neck. And so I get a lot of ENT, head and neck cancer training, a lot of kind of dermatologic skin cancer training and reconstruction. So all those things when I performed and trained in that, allow me the comfort to go, yeah, I can do your eyelid lift because when I trained, I did 75, 100 eyelid reconstructions because there was a tumor on the eyelid and, you know, it had to be removed, completely. And the person didn't have an eyelid. So we had to rebuild it. So, you know, again, not downgrading or diminishing an eyelid lift. Yes, I can make an incision in the skin below the eyelashes, lift the skin up, contour the fat, remove the extra skin, and sew it up. Comparatively, they're not technically the same as far as skill. If something goes wrong with the eyelid lift and the skin dies back and we need to rebuild the eyelid, because I've done so many eyelid reconstructions, at least in training as a base, and I may even continue that in my practice, then I'm comfortable. You want a surgeon who has credentials. So it's no way that you can say, drawing some parallels that people can follow me, that because I did ch- medical school and I actually did dental school as well. I did uh, general surgery training. I did 3 years of that. I did oral surgery training. I did 4 years of that. I did 2 years of plastics. That I'm not qualified enough to do your plastic surgery, your aesthetic plastic surgery, your breast lift, your breast reduction, your body makeover, your facelift, your chin surgery, what have you. I have the qualifications. Other specialties, especially I'll pick on the cosmetic surgeons because they come from everywhere and they typically don't have that training. They'll have some type of training. It could be medical in a sense, it could be surgical, they could be an oral surgeon, double degree oral surgeon with 1 year general surgery training and nothing else. And they'll do a fellowship in cosmetic surgery where they are mentored by someone. And they'll go out and do these things. And they go, oh, he is a plastic and reconstructive surgery. He's not as qualified, or they intimate that he's not as qualified as I am, a cosmetic surgeon. It's just not true. You know, I worked my way up with all that training and experience, and I'm experienced it. You took a lesser route, put your shingled out a little earlier because you shortened it, and you call yourself the guru. Not so much. So, you want to make sure that your plastic surgeon is trained as I've outlined. Medical school, foreign or domestic, it doesn't matter these days. You want to make sure they have core surgical training, typically general surgery, but it can be oral surgery as long as they have a medical and dental degree. It could be urology, it could be neurosurgery, it could be ENT, it could be, I think I've left orthopedic surgery. And then after that, then they should have training in plastic and reconstructive surgery, which is 2 to 3 years. Once that's done, then you want to make sure that they're board certified. And the best way to do that is go to the American Board of Plastic Surgery and check out their credentials. It takes about 3 years to go through the certification process once you've completed your plastic surgery training. So somebody who just got out is not going to be board certified. Doesn't mean they're not well trained. They just haven't had the chance of going through that process. It takes a minimum of 3 years, maybe five, to have enough cases to sit for completion of part one and part two of the board. But after 5 years of being in training, being in practice rather, if you're considering a plastic surgeon as one of your candidates uh, for your particular procedure interest, you need to make sure that they're board certified by the American Board of Plastic Surgery, not the American Board of Surgery, not by the American Board of Otorhinolaryngology, ENT, not the American Board of Cosmetic Surgery, because that board is not even recognized by the American Medical Association or the American Board of Medical Specialties. So, not that. It's only this one. So, let's just cut to the chase. That is the qualification that matters. Moving forward from that point, your plastic surgeon that you choose potentially as your candidate because you're putting your life in their hands may be a member of the Aesthetic Society or they may be a member of the American Society of Plastic Surgeons. It's not mandatory, but it's nice to see. Uh, so those are the qualifications. You want to make sure that, you know, your plastic surgeon has served in each step of the process. We'll break that down. Did they serve locally, medical school? Did they serve their state and maybe as a trainee? Did they serve in higher end of medicine, maybe in their local government as a representative or in DC, so to speak, in the bigger picture as a trainee? Then did they pass all the certifications to sit for the American Board of Plastic Surgeons? And are they qualified to call themselves, once passing that exam, a fully trained, board certified plastic surgeon? So you want to make sure that those qualifications are checked off, and don't let anybody tell you that there's someone who's gone through that pathway is not trained. Now, having said that, you can have that person that's adequately trained along those lines. Character determines destiny. I'm going to quote someone named Richard Howe, who I met a long time ago, very influential oral surgeon now, as I was a young dental student trying to navigate my way in life to figure out what I wanted to do. I trained eventually in oral surgery, but he was instrumental in that direction. And we were having a discussion because he was a brilliant guy. And he gave me some advice. He's like, character determines destiny. And I believe that. And I say that to my kids. I say that to my wife. I say that to anybody who listens, who wants a bit of advice from me. What words can you give me? Character. listen to me closely, and this can be applied to anything in life, determines destiny. So the character of your plastic surgeon, let me reel it back from the greater question and the greater, overlying story I'm telling here is you want your plastic surgeon, as much as you can vet, to be of good character. Despite going through all the rigorous training and checking off those boxes, you want to make sure that they've not had any malpractice suits that were a breach of the standard of care. And I think that's the determining factor in my mind for a malpractice suit, because you can have malpractice suits that are registered by your local state medical society. And there's context, meaning that you can have a suit. A person had a tummy tuck and liposuction, and everything was done right. They developed a clot in their leg, a deep venous thrombosis, a DVT. They subsequently had a piece of that clot break off from their leg, go to their lungs. That person ended up very sick in the hospital, near death. And let's say maybe they died, unfortunately. But the plastic surgeon, who's adequately trained, no problems there, adequately performed the surgery, no problems there, adequately took care of the patient, put them on the appropriate medications afterwards, saw them appropriately in the office. And this was just a unfortunate outcome. And the patient's family sues that person. And they may sue them, and there may be some type of settlement or some type of malpractice suit or judgment. Uh, Maybe there wasn't a quick enough diagnosis. That's a little sketchy, but maybe that's it. So that can be recorded in the National Practitioners Data Bank as a negative event for that particular surgeon. In my opinion, this is my opinion only. You can have a malpractice suit where that same thing happens, but the plastic surgeon didn't put the patient on blood thinner. That's a egregious thing to happen. That's not the standard of care. The plastic surgeon uh, didn't stop bleeding. The patient was obviously bleeding, and the staff let the doctor know in the recovery room or afterwards, or even the patient's family called. They didn't. They didn't. They didn't care. They didn't do it. Or the plastic surgeon, you know, doesn't understand the anatomy, or did something, performed some type of shortcut, used an inferior product that's not FDA approved, and just got in a bunch of trouble. Basically, used poor judgment. That's a character flaw. You don't want that plastic surgeon. You don't want a plastic surgeon who has a character flaw where they have numerous sexual assault or sexual accusations from patients and or staff. You don't want a plastic surgeon that has accusations or frank allegations and convictions for financial uh, misdeeds. You want a plastic surgeon that has integrity. Doesn't mean people don't make mistakes. That mistakes that happen repeatedly are called habits and patterns. They're not mistakes. So you want a plastic surgeon of good character. So the overarching themes, you want them well trained and with the right qualifications. You can't dispute that. And you want somebody of good character, someone who's morally representative of the field of medicine and specifically plastic surgeon. Someone has good moral fiber, who you believe has integrity in the most difficult times to make the best decision for all, not the best decision for them. So those are things that I want to talk about, as far as plastic surgery. Again, I said it was going to be a bit of a smorgasbord. I want to reiterate, when you're thinking about plastic surgery, please think about those things. just a little bit of a take on that, a little bit of a deeper dive. I see in the social media groups that, I want to have my eyes done, upper eyelid lift, lower eyelid lift. Should I go see an oculoplastic surgeon? Should I see a facial plastic surgeon? Should I see a plastic surgeon? Well, the answer is you can see them all. They're all qualified to do that. That's not a problem. If you're interested in a facelift, should you see a facial plastic surgeon? Should you see an oculoplastic surgeon? There are oculoplastic surgeons that do facial work. My opinion, again, only. I don't think they have the broadest range of training. I'll be gentle to perform that procedure. You can see a plastic surgeon. And if your decision comes between a facial plastic surgeon or a plastic surgeon, there's really no difference in the training. If they meet all the criteria of the requirements of the academic work and they have good moral character as much as you can tell, and their work outcomes and results are equal, it's up to you. They're equally trained. If you see a facial plastic surgeon who sometimes will call themselves a plastic surgeon and they want to do your breast, then that may be a different story. They can't do your breast. Or you see an oral and maxillofacial surgeon doubly trained, MD DDS or DMD MD, and they've done a cosmetic fellowship and they want to do uh, your nose. Maybe that's okay. But if they want to do your breast, then that's probably not okay. Let's just cut to a chase. And I used to be, I will say, but I always am an oral surgeon. I trained in oral surgery. I have the certificates, but I've trained in plastic surgery as well. It- They don't. They can do the breast lift, but what if they need a breast? What if there's a complication and the nipple falls off because it's necrotic or just poor circulation? Can they rebuild the nipple? No, they can't. They can't do that, nor will they do that. Your plastic surgeon can. My point being is plastic surgeons are like the umbrella. They can cover all aspects. They can do what a facial plastic surgeon can do, but a facial plastic surgeon can't do what a plastic surgeon does. They can do what an oral surgeon does. That's a cosmetic surgeon, but the oral surgeon cannot do what the plastic surgeon does. They can do, or plastic surgeons can do what an oculoplastic surgeon does, but the oculoplastic surgeon cannot do what a plastic surgeon can do. So the plastic surgeon is the umbrella. They can do all things. And I'm not saying that just to say that because I think you guys think I'm cocky. It's the training. That's the differentiating point. It's the training. So enough about that. Hope you got that message about training and qualifications and candidates and character in this most pivotal time on Tuesday and for you whenever you decide to have plastic surgery, whether it's a Tuesday, Thursday, Friday, this week, next year, 2 years, etc. On that note, a couple of things that are coming up. We're pivoting because, as I mentioned earlier, it gets a little daunting to come up with topics because plastic surgery is finite. I mean, I can only so many times talk about breast implants and Botox and Juvederm, so I don't want to repeat that. Uh, so what we're going to do is we're going to try to step this up. I would love for you to like and subscribe. It will help my page become more visible. Maybe I can even attract more eyes that will give us some advertisement. We can do a lot of great things, but that's not this step. The next step. The next step we're going to take to keep this interesting, to keep everybody interested, including myself, is to have guests on. We've had one or two guests initially, kind of in a little bit different circle. We called it Hot Seat Saturday. We had Dr. Mike Kissel. He talked about, these weight loss drugs like Wegovy and Ozempic, and that was really interesting. And then we had a brand photographer on, Robin Snyder Stephenson. Yes, that is my wife, for clarification. Uh, talk about branding, putting your best self out there. Once you get all these fabulous procedures and you feel fabulous about yourself, it builds, it confidence. So you can go out and put your best foot forward and immortalize that with brand photography in your business, or you want to use it for family. Uh, for your family and to do all those things. So talked about them. We had those two guests on. We're going to move forward. We're going to get some more guests. We're going to talk to fitness trainers. We're going to talk to recovery, plastic surgery recovery nurses. We're going to talk to other plastic surgeons about the unique things they do in their practice. Maybe we can even have some plastic surgeons come over here and we can look at case, both of us, and we can determine how we would each approach that case. I think that'll be interesting for clients to see how two plastic surgeons look at a case totally different, but come to basically, the same conclusion. So just puts you guys in our minds to kind of tell you or give you an insight of how we're thinking. But we're going to have guests on. That's the big thing. We're going to have guests so we can diversify the discussions, broaden the discussions, make it more interesting. What would really help if you guys would just leave me comments. You can do it a couple of ways. I invited a couple of ways. You can just email me. Just, hey, I saw your podcast. I think it's interesting. I always wanted to know about X. And I've had a couple of people do that in the last couple of weeks. I had somebody say, hey, you really haven't talked about breast implant illness. So I talked about that. That was right. I didn't really come to my mind. And so hopefully that was helpful for people who may have questions about that or are curious about that. I had one of my old high school classmates reach out to me. Hey, some of us are not ready to go under the knife. Can you talk about non-surgical things like microneedling? So that's coming up. I'm going to talk about microneedling and what I think are good devices and what works and why it works and what doesn't work and why it doesn't work. So it really helps if you would give me suggestions. So you can definitely send them right directly to this email. You can go to all our social media. I'm on Facebook. I'm on Instagram. I'm on TikTok. Just leave some suggestions. The more I get from you, then the more I can give back to you as far as, answering that question and then multiplying it. Because I know what I would like to talk about, but really this is not about me at all. This is not about me. I want to make it completely about not about me. I want to make it about you. I want to give you the information that you want. So the best way for me to do that is for you to tell me what's on your mind. So you got to tell me what's on your mind. So I invite you to use that email. Just email me what you think I, should talk about or what you want to learn about, or you can go to our social media platform and just kind of leave a suggestion in either the comment boxes or what have you. So that's what's happening. If you are interested, here comes the shameless plug. You always can come to our office if you want to talk to me about anything that you're concerned about. You're ready. You've already vetted me. You think I meet those criteria. Hopefully, I definitely meet certainly the criteria of the character. uh, Only you can determine that once you meet me, and then the little back end investigation. Definitely meet the criteria for all the educational uh, components of this. So, if you're interested in anything from a facelift to eyelids to chin surgery to a mommy makeover to fat grafting to your backside, then we're the place here in Atlanta. I mean, there are a lot of great plastic surgeons here in Atlanta. I'm not going to say that there are none, but we provide you with service and an experience that's unparalleled. And we strive every day to make that better. It's not just we've reached nirvana and we stop. Every day we strive to make that better. So if you're interested in that, let's start the conversation. Just give me a call at 770-466-4700. I'd love to sit down and chat with you. uh, Complete transparency, there is a consultation fee. You can go and get a free consultation from other places or a consultation for X amount of dollars. There's a consultation fee. And transparently, again, because we're adults here, you can decide right now if I'm your cup of tea or not based on the numbers, because sometimes it does just get down to the numbers. Our consultation fee is $225. Yes, that's $225. Would you sit down with me, not for 10 minutes, not for 15 minutes? I'm not rushing. We sit down for at least an hour, maybe sometimes an hour and 15, an hour and 30 minutes, because we're not in a rush. I'm here to make sure that you're comfortable with the information that I'm giving you, the recommendations I'm giving you. so that you can make the most informed decision. If you decide to move forward, if we think that we have a solution for you, whether it is a tummy tuck, whether it's liposuction, whatever it's pinning your ears back and contouring them, then and you move forward with a procedure, then we deduct that $225 from the total cost of your procedure. So you've already bought in. So I'd love to come talk to you if you're interested in plastic surgery. Uh, if you still haven't quite made up your mind, I invite you to continue to listen to my podcast, Plastic Surgery T&A, every Saturday, available on YouTube after 11 a.m. Eastern Standard Time. And I would love for you just to share it. If you just click the arrow and share it, that'd be great with anybody, your social group on social media, your girlfriends, your guy friends, because we do men's surgery too, chest contouring, liposuction, Botox, etc. Share. Really would love if you subscribe. We really like to get our subscribers up. Just, do us a solid and do us a favor. I know people ask you this all the time, but I really would like to make this channel uh, known more broadly because I think we have good information to share, honest information to share. So until next time, please be safe wherever you are in the world, and God bless.